I'm very excited today to look at different tongue mapping. We all know the regular TCM tongue mapping with the split into thirds, and so the front third is your upper jowl, middle third, middle jowl, lower third, lower jowl, right? And then we've got the heart and lung at the tip, liver, gallbladder at the side, spleen and stomach in the center, and then of course everything else below the navel pretty much at the back. We all know that. So here's some extra ones for you to look out for in your clinic, really helpful. The first one is the spine. Now this is an Ayurvedic tongue diagnosis. So we all know the midline crack, right? You see from almost from the back, right straight to the tip. We call a heart crack in TCM, which could mean mental emotional disorder, or just that the person's constitutionally a bit more sensitive, a bit more anxious. But I want you to watch for this in your clinic. It's a bit of a different look. It tends to be a bit more superficial of a crack. You'll see that midline crack, but you might see a little bit of a deviation in it or almost a split in it at certain parts. So I want you to think of this as your spine or the patient's spine. So at the anterior third, where heart and lung are, this whole area will be the C-spine. And the middle third will be the T-spine, and the back will be lumbar spine. Now, this is so incredibly accurate that if you see a deviation, let's say halfway through the anterior third, you can ask them if there is an area in their C-spine that maybe they've got a disc that is out, or at least a pain in the area is the thing to ask. I see this all the time, and it's really, really accurate. And so oftentimes the side it's deviating to is there's sometimes a scoliosis in the spine, or the issue is going towards that side. So if you see something between kind of T4, T7 in the middle third on the tongue, you see that line with a bit of a deviation, maybe it goes to the left, well then explore that area on the body. You can just ask the patient flat out, do you have any issues there? And 99% of the time, yes I do. There's one. Number two is strawberry tongue. Strawberry tongue is the entire anterior third of the tongue, looks exactly like a strawberry. I'm not joking, exactly. All the papillae are raised. It's really dark red to crimson red. Now this most often means parasites in the body. And if this is paired with a pulse that is absolutely raging, because remember that the Wei Qi, the upright qi, the pathogenic factor and the antipathogenic qi are fighting. Your body's desperately trying to fight this parasite. So you can ask your patient that if you see that tongue plus the raging pulse. And obviously they might have some symptoms too of feeling fatigued or nauseous or diarrhea or just not right. It could come in so many different ways. It could look like Lyme's disease. It could look like just parasites they picked up somewhere in South America or on a trip or something like that. Okay, so that's strawberry tongue. The next one's called beef tongue. You might have heard of this. This is actually a Western medicine idea. Beef tongue, don't really want that name, do you? Is a swollen tongue. It's red and it really looks quite beefy. Once you see it, you'll never forget it's a beefy look. Now, we oftentimes see burning tongue syndrome with this as well. Now, obviously, we're going to be thinking some kind of heart something in TCM, but in Western medicine, we're looking at probably a B12 deficiency. Now, I have seen this in many patients. Postpartum is the most common way I've seen it, where they've bled a lot during the birth, and their iron and blood levels have went very low, and they get this burning tongue syndrome. Well, what helps them the most, even more than acupuncture, is putting them on B12 supplements or sending them for B12 shots to their ND or something. It actually works better in my experience. All right, now the next one is only my own clinical observations. So maybe it's written somewhere, I have no idea. So you can gauge this for yourself in your clinic. But right behind the stomach area, between the second third and the back third of the tongue, sometimes you'll see a little area there that's a little circle, and you might see it burnt looking like a yin deficient tongue. Well, I've seen this a lot with small intestine dysbiosis. Okay, so maybe they have food sensitivities, food allergy, maybe they have leaky gut syndrome, they have a bacterial imbalance in their small intestine, they might have skin problems, digestive problems, food sensitivities, food allergies, something like this. And you know what? In my own observation and with asking my patient over years and years and years, oftentimes there's an antibiotic overuse at some point in their life, and it's stripped their small intestine, I believe, of its good bacteria. Please, that's only my own observations. So if you see that in your clinic, just ask. And the last one I want to talk about is very common. It's at the anterior third on the sides. Yes, that's the lung area, absolutely. So things you want to consider when you see issues on the sides, purple is a very common thing to see there. Well, not common, but you do see it. And if you see purple spots, I actually send them for referral. This is the chest. Yeah. This is the chest, thorax, breast, lung area. So if you see this, especially in a woman, but of course in any patient, on one side is the most common. I'm often wondering about breast lumps, and so I'll ask them anything fibrocystic, any lumps, any breast cancer issues in your family. If that's a no, 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 you can ask about lung problems or just pain in their chest or accumulation syndrome or something like this. So I often refer for this one if there's actually purple spots, because as we know in TCM, a purple spot is often some kind of growth, and better to be safe than sorry. And so there you go. There's some extra things about the tongue that you may not have known. Put them in clinic right now, use them right away, start questioning, and they are amazing. They are going to really help you.